Welcome to the Heart of It, where we take our listeners to the heart of healthcare. I'm your host, Dr. Victoria Lee, and I'm thrilled that for our first season, we'll be speaking with some of the exceptional people at Fraser Health that are at the heart of healthcare. As we begin today's podcast, I'd like to start by acknowledging that we are joining you from the unceded, shared, and traditional territories of the Coast Salish people, particularly Katzie, Kwantlen, Coquitlam, Tsawwassen, and Samiamu First Nations, as well as home to Surrey Delta Métis Association. Today, my guests are two people that are driving some of the most important work of our time, which is all about tackling our climate crisis and taking action to protect our planetary health. Dr. Emily Newhouse is our medical health officer for population public health, and Darryl Quantz is a planetary health lead. Welcome, Emily and Darryl.
Good
to be here. So I'll kick things off with you, Emily. How did you first discover that health or population health is your calling?
Yeah, so I've always been interested in the intersection of science and other social forces. So I first became interested in medicine actually because I heard something about Physicians for Human Rights, and I thought that's so amazing. They get to be physicians and do something that relates to science, but also connect it to some of the social issues that going on in the world. And then as I progressed, I ended up in population public health, which we get to work not just on treating illness, but on preventing it and looking at all of the different factors that contribute to making our health the way it is. And that includes lots of environmental health influences on our health, which is, I think where we're going to talk about more today.
Yeah, and that's the area that you have been leading in terms of that environmental health overall as an area of focus and specialty within Fraser, but planetary health is an area that you've also worked on in the last few years as well. Is there any particular reason that you were drawn to those areas?
Yeah, so I think, when you train in public health, you learn that environmental toxins and pollution and other exposures have serious effects on our health. And as I progressed, one of the things that I first found was a really exciting concept was this idea of healthy built environment. And this is the idea that if we design our communities in the right ways, we don't have to tell people to behave in healthy ways. Those environments will make it easy for them to be healthy. So when we make our communities more walkable, for example, we make it easier for people to get physical activity, which of course prevents chronic disease. And then as I learned more about climate change and some of these broader environmental factors that were impacting people's health, I just realized that there's just this amazing set of complex relationships that we need to understand better if we're going to achieve the best outcomes in people's health.
Darryl, I'll go to you next. Can you tell us a little bit about your journey into the health system?
I think for me, it was way back in my undergraduate days, just hearing the concepts of the social determinants of health and how much that resonated with me personally, and providing a different frame of what is happening in the world and why it is happening, and jumped on those opportunities from learning about those social determinants to have a graduate degree in community health sciences and doing work in population and public health. And eventually doing public health specialty training overseas, which was a fantastic opportunity to broaden my perspectives on things, and which actually was an opportunity for me to really get into the planetary health, climate justice agenda. So I joined Fraser Health about 2.5 years ago, and the acting chief medical health officer at the time, I had an opportunity to talk to her about my interests in planetary health and the social determinants, and felt that there was such a really good fit in terms of the things that were happening. And this was before the climate events that we faced in terms of the flooding and the heat event. But just felt like there was such an opportunity for Fraser Health to grow that role.
And what about you, Emily? When did you join Fraser, and any particular reason that you were drawn to working at the organization?
So I joined in Fraser in 2019. I really was attracted to the team. There was just a fantastic group of folks in population and public health. I'd gotten a chance to work with some of them during my residency. And so I knew that I was going to be working with a really really great crew. So that was one of the strong attractions for me. And I also was really excited about the opportunity to focus in environmental health. So I'd done a little bit of extra work in my residency, and I'm a medical health officer, but medical health officers have different regional portfolios of focus. And I had a strong interest in working in environmental health, and that was the position that was available. So it was an exciting opportunity for me.
Darryl, one of the areas that you've worked on for quite some time throughout your career is around social determinants of health. Can you talk a little bit more about what social determinants of health are and how they impact the services that we provide?
Sure. When we look at how the health and well-being of communities is determined, healthcare is important, but it's actually a smaller factor. What's actually really influences the health and well-being of our communities is things like access to good jobs, access to the natural environment, early childhood, positive early childhood experiences, community networks, access to community networks and social connections. Those are the factors that really are impacting the health and well-being of our communities. So if we can impact those factors, and there's a lot of work in the health system to do that, we can really make a change for population health.
And speaking of what Darryl had mentioned earlier about some of the environmental impacts or extreme weather events that we've experienced, especially in our region in the last several years, we've had, 1 in 1,000-year event of the heat dome and 1 in a 500-year event of flooding and wildfires. Emily, are you able to share some of the key health connections between climate and health?
Sure. So you highlighted a number of extreme weather events, and I think some of the health effects of those are more evident on the surface. So, of course, heat-related illness, the injuries that you might have associated with flooding. But there's actually a lot of other health effects that are a little bit more subtle or indirect. And some of those relate to things like contamination of water, like when we have flooding or even heavy rain events that we're going to see increased numbers of with climate change. That puts greater strain on our water treatment systems and leads to higher chance that we have contaminated drinking water. We also know that with changes in temperature, we're going to have changes in insects and other what we call vectors, so carriers of certain kinds of infectious diseases. We know that there's going to be changes to our food supply. So sometimes some of the effects that aren't happening locally but are happening at a distance, so climate change that's happening elsewhere in the world, can affect the amount of food that's produced and then actually lead to changes in food prices, which impacts our ability to access nutritious food here at home. So there's lots of effects that are maybe more obvious, but there's actually all of these more indirect impacts we don't fully understand, but we know that they're really serious. And some of the most serious impacts, I think, are going to result from places on Earth becoming less farmable, less habitable, and some of the conflict and forced migration that we're going to see, where places are no longer healthy for people to live, and they need, and some of the conflict that arises because of that.
Yeah, I think you're highlighting some of the complexities that we live within in terms of the connected world, as well as connection between our environment and economics and cultural and other societal factors. So I'll go to Darryl with his thoughts on how the impacts of climate change are not felt equally by everyone. And what does that look like from social determinants and social justice perspective?
I think Emily referred to a key factor there around the conflict that we're seeing globally, and particularly in certain areas that are really experiencing it, and the impact that it's having again on forced migration. There's other factors. There's of course the next generation. We're putting this burden on our children, on our grandchildren, and for me, that's a huge motivation in wanting to work in this area. Even though we've recently experienced some very difficult climate events here, there have been these events happening for much longer elsewhere in the world that are maybe not as much in the public eye here as they should be, and that's being being more interested in this topic has made me more aware of these things that have been going on for much longer, and the impact that's having on people who don't have the resources to be able to address it. And as Emily mentioned, has significant impacts on their ability to earn a living and their health and well-being.
And speaking of, next generation, I think, Emily, you've got quite a full house yourself in terms of the little ones that you are raising. How do you feel about that in terms of that generational impact, and what kind of lessons and what would you like to leave with your children?
I do reflect on this because there are differences between my kids' childhood and my childhood that I never would have expected. I used to say to my kids, there's no bad weather, only bad clothing. And now in the summer with, wildfire smoke events, I can't say that anymore. I can't remember a time in my childhood where I had to stay indoors for health reasons during the summer. So it really strikes me that that's just normal for them. In terms of, what I'd like to leave them with, we have a lot of conversations about why our climate is changing, what's happening. And I really want to leave them with the sense that this is really important and deserves collective action. And that, prioritizing our climate and the environment is critical for humans' health and thriving.
Darryl, from your perspective, how do we actually ensure those types of messages resonate with our young people? And at the same time, I hear sometimes there's anxiety around climate and climate change.
From my perspective, I think that kids are so well in tune with what's going on, and so there's not a lot of education that's necessary in terms of what's happening. They're so, whether it's through schools or just exposure to social media, or their own just experiences that they're seeing and what's happening. I just think they get it. There's all these new terms: climate anxiety, climate grief, and kids aren't sleeping at night because they're worried about it. So we need to empower them to have that action. I've done work in my own kids' schools around empowering the kids to take action, and giving them the tools and knowledge about, even things like carbon literacy. What are we really doing? It's not just about picking up litter, and thinking about those opportunities for them to empower themselves, empower their school community. So I think those are the type of things that we know can help address climate anxiety, and in not just kids, but in everybody. It's being empowered to take action. Giving them those tools, I think, is an important approach to that.
And how did those sessions go, Darryl? Those educational sessions with the kids?
I think they're amazing at being able to comprehend such a incredibly difficult and emotive issue that you see the frustration from climate advocates that they feel that the current generation maybe is just not getting. So I think their response has been just interest in wanting to learn more, maybe surprise at certain things, and then just a realization that we need change.
Do you think there are some lessons that we can take from kids and youth and what they're doing collectively in climate, in our health system?
I mean, this is quite simplistic, but I think kids have a just get it done mentality. I think we can, being a big organization, any big organization can create barriers that they can be overcome. They're not insurmountable by any nature. So I think there's a message there for us to, let's make it happen. And yeah, it's going to be a challenge, but how do we do it? So I think there's some for me, some exciting motivation around that.
I think their flexibility is often quite inspiring. My family, we've tried to make certain changes here and there to decrease our impact, and the kids are just sure. And whereas the adults we're a little more inflexible, we're a little more grumbling when we try something new, but the kids are gung ho.
Yeah, they're more adaptable, as you said, and can be flexible. And sometimes, a large organization like Fraser Health, it can take a lot to move or change or transform. But you two have been central and pivotal to developing an impressive planetary health strategy that we're implementing. So it is possible. Emily, maybe I'll start with you in terms of what are some of the key components and why are you excited about the strategy?
So the strategy has 4 pillars. It ranges from reducing the impact of our services on the planet to creating a culture and system of social and environmental sustainability. It looks also at creating a climate resilient health system. And then it also focuses on something called an anchor mission. So I think the strategy is really exciting because it commits us to action in a few different areas. So sometimes in climate change, we talk about this difference between adaptation and mitigation. So adaptation is the work we do to adjust to climate change. So it's recognizing climate change is happening. What can we do to get ready for it and make sure that we're going to be able to function? Mitigation recognizes that actually we can't fully adapt to climate change. And if you look at some various projections and analyses, you can see that if we don't invest in mitigation, that is work to reduce the amount of climate change that happens, we won't be able to fully adapt. So one of the things that I find really exciting about the strategy is that it includes that adaptation component. So that's that climate resilient health system. But it also really focuses on the impact of our services, so that mitigation component. And the other thing I really appreciate about the planetary health strategy is it goes beyond greenhouse gas emissions and climate change, recognizing that there's a lot of ways in which healthcare impacts planetary health beyond just climate change.
I think as an example of some of the work that we're doing in terms of procurement practices and the types of food that we procure, the types of businesses that we engage with, again, with the mindset of reducing our overall impact and having more positive impact on our planet. And Darryl, you've seen some positive impacts of how being an anchor institute has had I think a much broader engagement in the community to activate in that collective manner.
I think we're still starting on our journey of that. It's a newer term for many people. It has its history in the U.S. actually in hospitals that recognized their ability to impact the health of their communities had to go beyond the services they provide. And so we're working and thinking about things that they could do to support the local economy, things they could do to support local communities, their role as an employer, their role in terms of their impact on the environment. So it was a real opportunity to look at those wider determinants. So for us, we are an anchor institution, just as local governments are, universities are, school districts, and we've been doing this already and maybe haven't labeled it as an anchor mission. So I think the opportunity there is to leverage that even further. And there are so many exciting ideas and opportunities that have come up from, as you mentioned, looking at the contracts that we have. Are there opportunities to get population health benefits from those that can help reduce health and social inequities, can reduce our impacts on the environment, can provide employment opportunities for those who might not have had a route in otherwise. So there are many exciting areas for us, for Fraser Health, explicitly saying that we want to develop our anchor mission.
And how would you take that kind of lessons from the kids being adaptable, just getting it done into the planetary strategy we have launched?
The health system is big, it's complex. There are so many different areas. We just need to bring the right stakeholders together and determine that journey of, okay, how do we make this happen? And sometimes it has, in the past, it's been forced upon us. The pandemic was a great example of having to get things done in a quick time frame. And we moved very quickly because we were short on supplies to having to use reusable isolation gowns. And that has become part of our Fraser Health work and a success story of making us more resilient, actually providing cost savings to the system, which is always helpful. And of course, reducing our environmental impact and the waste that we provide. So I think there's just that example of finding out the ways to make it happen, getting the right people involved. I think that engagement is so important. And we have actually created a circular healthcare working group, which for the first time brings together all of the right people and is very exciting for us as a health system to map out those opportunities.
How do you call urgency to action that when it is such a huge issue and such a big global challenge, how do we create individual and collective urgency to act now?
Yeah, I think that's the $1 million question. One of the things that we've been focusing on is sharing as much information as we can about some of the impacts of climate change, and really trying to share that it's not just, one heat event, once every few years, but really how um, how much climate change is going to touch so many aspects of people's lives that has impacts on their health. So I think that's one of the ways in which we've looked at how we can create a sense of urgency. I think the other really important piece is helping people feel like they have some next steps that they can take on. And whether that's within our organization or when we work with communities, I think the more, sometimes it can be very paralyzing if you hear about a challenge, but you don't have any ideas of what potentially can be done. And so, of course, here in public health, we don't have some of the levers over some of the important policies that impact climate change, but we can give information and do knowledge translation about what kinds of public policies and programs might help people adapt, or what types of action people can take on an individual level. And I think the more that people understand those linkages and they see clear paths to action, we'll have more of a readiness to do some of those important pieces that need to happen now in order to mitigate.
Yeah, I think that key of something that's practical, tangible, that can be done now. What is the most, I think, surprising thing that you think that the health system is tackling or will be tackling through our planetary health that you think people wouldn't know about?
Fraser Health was the first health region in Canada, as far as we know, to do a comprehensive analysis of the greenhouse gas emissions from inhalers. And our study of inhaler emissions found that the emissions from just inhalers were equivalent to about 20% of all of the emissions of our heat, energy, fleet, and paper usage of all of our hospitals, all of our buildings. So it was a huge amount just from this one prescription. Some people are aware of it, but there's always people who had no idea. And we actually did a survey where we asked our patients who are inhaler patients, were you aware of this? And 80% said no. But a huge proportion said they would like to be able to access lower carbon inhalers. And then, of course, empowering our patients. We did a survey of our patients, and 85% said they said that it was important to them that the health system reduce our emissions and waste. And we take that really seriously. And we're starting that journey of more formal engagement with our patients on this area.
I guess what I would say is I wanted to add something on a slightly earlier question, which is that I think it's really important that action on this is throughout our organization. One of the things that I really hope comes through in our planetary health strategy is that we develop the ability to do what I call sustainability QI, or quality improvement. And I think that we recognize that lots of that as leaders and people working this space, we don't have all the answers on how we can adjust healthcare to be more sustainable. We really need ideas and creativity from frontline staff to say, I've worked in this process and I see how it could be improved to be slightly more sustainable, to make tweaks along the way and maybe larger changes, because we know that when I talk to colleagues working in the area of sustainability in healthcare, we recognize that there's so much complexity here, and adjusting healthcare to become more sustainable is not something that we have an instruction manual for. So we really do need engagement from everyone and ideas from everyone across our organization to make this successful.
Great. And what is one thing you'd like to let our listeners know about the health system?
I think what I would like to let listeners know is that the health system is full of amazing, caring people who not only want to provide the best healthcare possible, but are also thinking about all of the impacts of healthcare and how we can make it healthy, not just for the patients it's serving, but for our broader communities. So in every day, I can't believe how passionate and compassionate the people are that I'm working with. It's just I would love them to know what a stellar group of people work here.
Yeah, I love what you said. It is a group of people who are committed to making their communities a healthier, better place. And I just think the power of the health system is so important. We've got so many healthcare workers who are dedicating their own time to being advocates around climate and planetary health activities and actions. So I think that's a really powerful message that climate activists around the world are being supported by healthcare workers.
Well, thank you so much, Emily and Darryl, for taking time with me today and talking about what WHO has determined as the most important health issue of our time and your leadership as we face this work. And as you said, let's get it done together. And that's it for today's The Heart of It podcast. Join us next time as we continue to get the heart of healthcare. And please don't forget to subscribe and rate this podcast. The Heart of It is a Fraser Health production. I'm Dr. Victoria Lee, your host. Vanessa Wasno and Kevin Smith are our producers. Recording and editing is done by Fraser Health Communications and Public Affairs.